Abdominal clinical examination. Inspection of the umbilicus. Teaching of general surgery for medical students. Items of inspection of the umbilicus. The site, umbilical discoloration, umbilical pigmentation, umbilical nodules, umbilical granuloma, umbilical polyp, umbilical sinus, umbilical fistula, umbilical discharge, umbilical hernia. The umbilical site. Normally, the umbilical site is in the midline, midway between the xiphoid and the symphysis pubis, opposite the disc between lumbar 3 and lumbar 4 vertebrae. Normally, its shape is rounded, retracted, and inverted all around. It is sunken in the obese persons, and it is flat or everted with ascites. The umbilicus is shifted away from the sites of increased upper or lower intra-abdominal pressure. Strange enough, there is no umbilical position shift with even multiple pregnancies and deliveries. Umbilical discoloration. Endometriosis. Endometriosis is an ectopic endometrial tissue enlarging with increasing pain during menstruation. Bluish discoloration of the umbilicus. Cullen's sign. Superficial edema and bruising in the subcutaneous fatty tissue around the umbilicus due to intraperitoneal hemorrhage. It is a good sign for the presence of intraperitoneal hemorrhage. Umbilical pigmentation. Nevus. The nevus is a benign pigment cell neoplasm, benign neoplasm, superficial. Melanoma. It is malignant skin pigmentation neoplasm. Sister Mary Joseph nodule in the umbilicus. It is a malignant skin pigmentation derived from intraperitoneal structures. Pigmentation may occur at the distal end of the vitello-intestinal duct as an umbilical polyp. May occur and may not. Umbilical pigmentation is rare with Peutz-Jeghers syndrome. Pigmentation as a part of the midline linea nigra gravidarum after the first pregnancy. It is permanent after that. In the midline, black line. Novoid acanthosis nigricans. It is a rare form, presence at birth or before puberty, solitary, well-defined, hyperpigmented, velvety plaque, not associated with any underlying disorder. It is velvety. Umbilical nodules. About 38% of umbilical nodules are primary tumors of the umbilicus. And endometriosis occurs in 32% of umbilical swellings. Metastasis from a distant location occurs in 30% in the umbilicus. Sister Mary Joseph nodule. It may be the sole indication of an occult malignancy. Also, it is called Sister Mary Joseph sign because it's a sign indicating malignant transmission. A palpable nodule bulging into the umbilicus, a distant metastasis of a malignant cancer in the pelvis, the abdomen, or the breast through the falciform ligament. May be painful on palpation, may be and may not. This is nodule. Endometriosis. Umbilical granuloma. It is a moist red lump of granulation tissue. It appears after falling of the umbilical cord. It is a minor problem that looks worse than it is actually. It is not worse. It is minor problem. It is a painless lesion. The granuloma. Umbilical polyp. Persistence of the umbilical end of the vitello-intestinal duct leads to formation of an umbilical polyp. It is lined by intestinal mucosa. Umbilical sinus. Vitello-intestinal duct sinus due to persistent patency of the distal part of the vitello-intestinal duct. The vitello-intestinal duct has other names. It can be called omphalomesenteric duct or the vitelline duct. It is lined by intestinal epithelium. Urachal sinus due to persistent patency of the urachus in it's lined by urinary epithelium, the distal part of the urachus. Pilonidal sinus due to the congenital subcutaneous hairy skin invagination through a very narrow duct. The hair protruding from the depth through the very minute duct. Umbilical fistulae. Congenital umbilical faecal fistula occurs due to persistent patency of the whole length of the vitello-intestinal duct or the vitelline duct. Congenital umbilical urinary fistula. It occurs due to persistent patency of the whole length of the urachus. Umbilical discharge. Causes of umbilical discharge. Congenital umbilical fecal fistula due to patent whole length of the vitello-intestinal duct or the vitelline duct, or sinus, vitello-intestinal or vitelline sinus, which is patent distal end of the vitelline duct or the vitello-intestinal duct. The distal end only forms sinus. The whole length forms fistula. Congenital umbilical urinary fistula occurs due to patent urachus, patent whole length of the urachus, or congenital umbilical urinary sinus occurs due to persistent patency of the distal end of the urachus. Discharging infection after laparoscopic surgery. Ulcerating umbilical hernia. Discharging umbilical abscess. Recurrent umbilical folliculitis. Advanced gallbladder carcinoma. Discharging umbilical pilonidal sinus. Omphalitis occurs more in children, newborn. Umbilical hernia. Umbilical hernia means loss of inversion of the umbilical cicatrix all around. The whole cicatrix is not inverted, lost its inversion. The whole length of the cicatrix has been lost. This is an umbilical hernia. For umbilical hernia, there is partial loss of the umbilical cicatrix, partial loss of the upper pole, and partial loss in the lower pole. These are para-umbilical beside the umbilicus, not the whole umbilicus. This is an umbilical hernia. This is a para-umbilical hernia. The para-umbilical hernia occurs at the part of the cicatrix. The umbilical occurs through the whole cicatrix and loss of the inversion of the whole cicatrix. Here, the para-umbilical partial loss of the cicatrix at one part, whether upper or lower pole. I have the pleasure to invite you to subscribe to my channel and visit it to view and select what you need. This is the link of my channel. Good luck and best wishes.